Hello, I'm Ailsa Bosworth, founder of the National Rheumatoid Arthritis Society. I was diagnosed with rheumatoid about 30 years ago now, and things were very different then. We didn't have the drugs that are available today, and the way treatment was given was very much more delayed. One of the exciting developments in the treatment of rheumatoid arthritis has been the launch of the NICE RA guidelines. One of the most important features of these guidelines is monthly monitoring when you've been newly diagnosed. One of the things that we found out from talking to you about it is that most people don't actually know what their DAS score is or why it's important to measure it. So you'll hear from others on this DVD about what DAS is, how to measure it and so on. And it really is important that you understand it, you find out about it, and you are having your DAS score measured. So if you don't know what your DAS score is, next time you see your consultant, ask about it.
Hello, I'm John Isaacs. I'm Professor of Clinical Rheumatology at Newcastle University and a Consultant Rheumatologist at the Freeman Hospital, Newcastle upon Tyne. The DAS score is what we call a composite measure. It's calculated by a mathematical formula that takes into account the number of tender joints you have, the number of swollen joints you have, a measure of inflammation in your blood called the ESR, and your assessment of your overall disease activity. To assess your tender and swollen joints, the healthcare professional, generally a nurse, sometimes a doctor, will look at individual joints in your hands, your wrists, your elbows, your shoulders and your knees. They'll gently press the joints to decide how many of these joints are tender. They'll examine them to decide how many of these joints are swollen, and these are the numbers that go into the formula. You'll have a blood test taken, and that gives your ESR result, and then you'll be asked to mark on a so-called visual analog scale where you think your rheumatoid arthritis is on that particular day, a score from very bad to very good. When you finally get your number back, if it's greater than 5.1, this suggests that your disease is very active. If it's less than 3.2, then it suggests that your disease is under good control. And if it's less than 2.6, then it's under very good control, and you'll probably have very few symptoms. It's important to state in that context, however, that there are extraneous factors that can affect the DAS score over and above your rheumatoid arthritis. So on any particular day, it's important to discuss your DAS score with your doctor or nurse just to make sure that it really is likely to be an accurate representation of your disease on that day. Having got your DAS score, that could then guide treatment. So for example, if your DAS score is very high, 5.1 or more, it's likely that your doctor or your nurse will suggest that you increase your dose of medication or perhaps add another drug or change your therapy completely. On the other hand, if it's very low, if it's less than 2.6 for example, and you're on multiple medications, that might be the signal to your doctor or nurse to start taking you off one or other of your drugs and reducing your therapy. This DVD will take you through the key stages of the DAS28 examination as carried out by an experienced rheumatology healthcare professional.
At the start of your consultation, your nurse or consultant will ask you to take a seat and remove your shirt or blouse so that your shoulders and arms are clearly visible. To enable easy access to these areas, it may be advisable to wear a vest top under layers to your consultation. And for men, it may be necessary to remove your shirt altogether. The examination process typically takes around 10 to 15 minutes to complete. During this time, the nurse or consultant carrying out the assessment will examine a total of 28 joints found in your shoulders, elbows, wrists, knees and hands, observing for swelling and tenderness. When assessing each of your joints, there are a number of common examination techniques that will be used, such as comparing your joints to assess for differences. For example, comparing the left shoulder with the right, observing for swelling and changes by viewing your joints from front, back and side angles. Asking you to move your joints, both independently and with assistance, to observe whether you have a full range of movements and to see if this causes you any problems or discomfort. Pressing on your joints to assess for swelling and tenderness, and examining your joints for warmth by sweeping across the area being examined. Those with a higher temperature than average may be an indication of active or inflamed joints. As well as these common techniques, there are some specific tests designed to assess individual joints, which will now be demonstrated. Step 1. Shoulder examination. During this examination, your nurse or consultant will hold onto your shoulder and move your arm out from your side to assess your flexibility. They will ask you if the movement has caused you any pain or discomfort, and they will observe and feel for any swelling in your shoulder joints that may indicate fluid is present. Step 2. Elbow examination. During this examination, your nurse or consultant will move your arm so that they can examine your elbow and the range of movements you can make. They will examine your elbow joint by pressing and observing for any swelling, and will ask you if you feel any tenderness. Step 3. Examination of wrists. During this examination, you will be asked to move your wrist up and down and say if this movement causes you any pain or discomfort. Your nurse or consultant will then examine your wrist and press along the joint to feel for swelling and assess for tenderness. Step 4. Examination of hands. During this examination, your nurse or consultant will be looking at two sets of joints, your knuckles and the joints midway along your fingers and thumbs. In order to examine these joints, they will rest your hand on a surface or pillow and press on either side of the joint, looking for the movement of fluid and asking you whether this causes any pain or discomfort. They will then continue along your hand until all your fingers and thumbs have been examined. Step 5. Examination of knees. For this examination, your nurse or consultant will use two hands to push down and feel around the joint to help clearly identify any fluid that may be present, causing swelling and tenderness. They will then sweep along the sides of your knees, which may cause a bulge to become visible on the opposite side if fluid is present. Extra tests. Some healthcare professionals may ask you to do additional tests to help them assess your joint flexibility, such as A. making a prayer sign, or B. making a fist. Step 6. Recording the results. During all stages of your examination, your nurse or consultant will be recording any swollen or tender joints on a score sheet, which they will refer to later when calculating your disease activity score. Step 7. Global Assessment of Disease Activity. The Global Assessment of Disease Activity is a scale to indicate how your health has been affected by your condition. Your nurse or consultant will ask you to say how your general health has been over the last week, or in some cases, they may ask about how you feel on the day you're being examined. Your general health, sometimes called global health, includes all aspects of your rheumatoid arthritis, including pain, fatigue, how you're functioning, and how this affects your life. The scale ranges from 0, meaning normal or mild, to 10, meaning very severe. They will ask you to mark a line on the scale to indicate your level on the day, or in the last week. Step 8. Reviewing blood results. You will have been asked at your last appointment to have a blood test in advance of your next consultation, and your nurse or consultant will review these results with you and take these into consideration when calculating your DAS. Step 9. Calculating DAS. Having carried out the full assessment, your nurse or consultant will total up all the swollen and tender joint scores and combine them with your global assessment of disease activity and blood results to calculate your disease activity score. Step 10. Consultation. Your nurse or consultant will discuss your disease activity score with you and compare it against your previous results, indicating if any action is required and discussing a time for your next appointment.